Hi, I'm Dan Pollyea. I'm a professor of medicine at the University of Colorado in the Department of Medicine and in the Division of Hematology. The next abstract to discuss is by Guillermo Garcia Monero's group at MD Anderson, and he led a large multinational phase 3 study in MDS looking at luspatercept versus an erythroid stimulating agent in lower risk MDS patients. And so this is an approved therapy, luspatercept, currently in the rather narrow setting of MDS patients who have an SF3B1 mutation or ring sideroblasts. And that's a function of the way that study was done, but there's long been suspicion that patients without that specific finding could also benefit from this strategy. And that's essentially what this randomized study looked at. So patients in this study had to have low-risk MDS who were requiring transfusions, but did not necessarily need to have ring sideroblasts or the SF3B1 mutation, which usually go together. This was a large study, about 180 patients in each arm, and the primary endpoint was increase in hemoglobin and red blood cell transfusion independence. And this was superior in the luspatercept arm compared to those patients who just received an erythroid stimulating agent. So that was certainly a very exciting finding to see. I think that was also, for those of us treating this disease, it was felt to be a very clinically meaningful improvement. Other endpoints also looked good with respect to the duration of transfusion independence in particular. Also, luspatercept is a therapy, again, that we have approved and are using in the clinic. So the safety profile is pretty well known. Fatigue being one of the major adverse events. That was, again, seen in this study, but to my eye, nothing else new or concerning in terms of a safety signal with this therapy. So in summary, the primary endpoint was met. The improvement in hemoglobin and transfusion independence was definitely superior compared to patients receiving only an erythroid stimulating agent. And I think this really opens up the opportunity to expand the use of luspatercept beyond what is currently a rather narrow entity into more of these low-risk MDS patients.